Hello, my name is Dr. Masi Hashemian from Park Place Dentistry. In this section, I want to talk about the benefits of Invisalign. A lot of people ask, why do I want to have a straight teeth, or why do we recommend Invisalign? Basically, there are different reasons that one might need to straighten their teeth. Not everybody wants to have perfectly aligned teeth, but sometimes it's not the look of it, it's the health of your gum and teeth. If the teeth are crooked and jammed together, basically there's more chance of getting gum disease. It's much harder to keep it clean. You will need more often visits to your dental office to have it cleaned up for you. Eventually, it's much easier to get cavity between the teeth that are overlapped. Also, the lower teeth with top teeth, if they're crowded, they can hit each other in a not correct way and basically cause fracture of the tip of the teeth, and people call it accident, but basically it's because they're not aligned correctly. Kind of like a key and the lock. If they're not fitting together correctly, eventually the key might break. So if the teeth on the upper jaw and lower jaw are not fitted correctly together, they eventually hurt each other. They cause fractures, cracks, and eventually major problems that could be totally prevented. That is why when I see a situation like that, I offer the Invisalign for our patients. When we align the teeth with Invisalign, basically we use a series of clear trays, and these trays are fitted for that patient, and they're worn for 2 weeks at a time. In 2 weeks' time, the teeth are going to be directed to go to the direction that the aligner is. We call it align. The clear trays are called aligners. So it's kind of tight and uncomfortable when you put it on, and then in 2 weeks it's going to be very comfortable. Then you get another set of new aligners, tight, you wear it, it fits in 2 weeks, and it gradually moves towards our goal to where the teeth in the upper jaw and lower jaw are going to fit together correctly. It's very important to wear these aligners all the time, except when you eat or drink. If you take it out and keep it in your pocket or in your purse, it's not gonna work. And the teeth are gonna move back, not necessarily to where you started from, to somewhere that it wouldn't even fit your aligner later. So if you're deciding and investing in Invisalign, you should follow the direction and wear those aligners 20 to 22 hours per day. That's the only way it works. And then once you finish the whole series, and depends on how many aligners it's going to take to move your teeth or shift them to the correct position. But once you're done with that, it is crucial, I require from my patients to retain those teeth. That's a big investment you're doing. You might as well protect that investment. Retaining, I insist on wearing the retainers, and you can have clear retainers, about 6 months to a year after you're done completely with your treatment. And the reason is that the bone needs time to get thicker and more stable around the roots of the teeth. When we shift the teeth, basically in the new position that the teeth are, the bone needs to get thick and support the new position. If you don't wear the retainer, teeth have memory, they're going to go back to where they started from. Therefore, the retaining phase to me is very, very important. After the first year, you can wear your retainer maybe a couple of times in a week at night. That should be fine. And if you feel that's getting a little bit difficult to fit your retainer at night, that means your teeth have been shifting. So you have to wear your retainer that week a little bit more often. So I just want to make sure that anybody who invests in Invisalign remembers to retain the teeth after the Invisalign treatment is completed, not to waste your investment. Thank you very much for paying attention to what I had to say about aligning your teeth, making them healthier, looking better, but mainly healthier. Thank you.